So this is for Lonnie Johnson musculoskeletal assessment. Okay, so my name is Lonnie. I'm going to be your nurse today. We're going to be doing a quick skeletal assessment of your body. So I'll be doing some movements. So first, provide privacy, wash my hands, check the name and date of birth of the patient, verify it's the correct patient, and then we'll start. So first things first, just to make sure, do you have any like deformities or anything that you want to tell me about? Any broken bones or anything like that? Any points of like soreness, any joints that you can't move correctly or anything like that?
No.
No. Perfect. Okay. So if you wouldn't mind just putting your leg down. Okay. So in general, if I'm looking at him, everything looks symmetrical. Like arms are symmetrical, bilateral lower extremities symmetrical, muscle mass seems to be average build, regular on all the sides. It's not like there's any muscle deformities or anything like that. Okay, so we will first start then with the range of motion for your arm here. So put my arm here and just kind of feel the joint, and then I will actually move the joint this way and this way. It feels good. I'm going to kind of put it this way. Okay, no preface noted. And I'm going to come down here to the elbow, and we're going to bend the elbow up, bend the elbow down, up and down. Everything feels good. I don't feel any swelling or anything like that. Now, if anything during this hurts at all, just let me know and we'll stop, okay? But there was no pain or anything like that. Okay. So this is the wrist here, so I'm going to move the wrist. Okay, just kind of manipulate the wrist there. Check the fingers. You can bend and scrunch all your fingers. Yes, okay. So let's see here. I don't see any deformities of the fingers, so that's good. We're going to go to the next side over here. So I'm going to kind of do the same thing. Okay, so I'm going to put my hand on the joint here. I'm going to come up. Down this way. No pain?
Nope.
Okay, so passive range of motion. The shoulders is good. Okay, and then I'll just kind of move the wrist here. Okay, and I don't see any deformities of the hands either. This is good. Okay, no swelling. So then from there, I'm going to go ahead and I'm going to move down to the lower extremities. So we will first try to feel the hip here. So I'll put my hand in here, get the hip. We're going to kind of bring this leg up, out. Okay. Any of that hurt?
No.
Okay, perfect. So then I'll move down here to the knee and maybe one knee here, down. Down. Okay. And I'm just going to take off your shoes off. Okay.
No problem.
Okay. So I'm going to check the ankle first. Move the ankle all around. And just try to let me move it, okay? Okay, nothing on the ankle. I'll check the toes. I don't see any deformities, anything like that on the toes. Let me just take this off the next side. Okay. So this side we're going to start with the hip here too. So I'll just kind of reach in here, grab the hip, and I'm keeping it up, out, in, up, out, in, and then knee here. Okay. And then the knee. Okay, and then move the ankle. Okay. And then move this ankle. There we go. That's what I'm going to do. Okay, let me move it for you, okay? Alright, deformities there. The toes look good. The swelling of the joints or redness. So, next, we're going to have you just go ahead and stand up for me, okay? So we'll turn around so I can just view your back. Okay, so just kind of feel the back here. I don't feel any deformities. It feels like everything kind of lines up. No history of scoliosis or anything like that, right?
No.
Okay, so I'm going to go ahead and have you lean forward for me. See if you can touch down to the bottom. Just towards your toes if you can bend over. Okay, any pain there?
No.
No? Okay, so I'm going to go ahead then and have you stand up and then lean backwards like this. We'll do that over here. Okay, perfect. We're just going to do all of our side stuff over here. So you can stand up now. Perfect. So then I'm gonna have you, if you wanna turn around and face me so I can show you. Okay, step back just a tad, there we go. Okay, so just lean to one side and then lean to the next side. No pain on those?
No.
Okay, and what about rotation? Can you rotate both ways? Okay, perfect. All right, looks good. So we're gonna go ahead and work with your shoulders here. So if you can go ahead and just put your shoulders up here and then all the way to the sky. Up to the sky. Up to the sky. There we go. All the way. Good. Okay. And no pain on that, right?
No.
Okay. Can you go ahead and just put your arms like this? Of yourself. Perfect. Okay. So if you can take one arm and place one arm behind your back. Good. No pain there?
No.
Okay. And then release and then put the other arm behind your back. Perfect. Okay. And we are going to do your head. Okay. So if you can put your head down to your chin, to your chest. Head back. All the way? Okay, perfect. And then I'm going to have you go ear to shoulder, and we're going to turn both ways of rotation. You got no pain on any of those?
No.
Okay, perfect. So then the next thing I will have you do, okay, go ahead and put your elbows out and in. We're just going to go out and in, Perfect, okay. And then put your hands out, and we're going to do wrist down, wrist up. Go back to this right here, and then can you move it in and out? Okay, perfect. And squeeze your knuckles with your hands, make that fist. There you go. Perfect. Okay. And rotation's good. All right. All right. Perfect. Looking good. So then, if I can have you go ahead, and you might want to hold on to a chair here. We'll put a chair next to you, and you will be holding the chair. Okay.
This way?
No, you're going to stand next to it.
Oh.
Sideways, like this. Here we go.
Okay.
Okay, perfect. So we will have you take one leg up, like this, okay, and then go back. Okay, now can you bring that leg forward and cross over? Perfect, okay, and then you can go out as well. Okay, perfect. All right, so now we're going to switch legs, and we're going to go ahead and do the next leg, and we're going to bring that leg up. Okay, perfect, and down, and back. There you go. Straight back, touch to the ground if you can. There you go, perfect, okay. And then we're going to have you bring that one back forward and move it across, okay? And then out. Oops, sorry about that. Okay, and no pain on any of those?
No.
No, okay. So then we will do, when you came up, you bend your knee, right? Okay, perfect. So then we are going to go ahead and do your ankles if you can. If you can rotate your ankles around for me, okay? And go up to the sky and down to the bottom. Okay, and we'll switch legs and do the next ankle around up to the sky, down to the bottom. Okay, perfect. And then I'm going to go ahead and check your grip strength. So before I have you sit down to check your legs, I'm going to check your arms real quick. So go ahead and come right here in front of me. Okay, so do me a favor and just squeeze my hands. Just squeeze. Okay, perfect. All right. And then I'm going to have you give me your hands. Thank you. So now I want you to bend back and pull towards yourself with your arms. There you go. Okay, now push against me. Okay, perfect. All right. And then we will go ahead and test your legs. Okay. So if you want to take a quick seat here, I'm going to turn it just a little bit for you so I can get this in. Okay. So if you want to go ahead and put your legs together a little bit for me and push out against me. Okay. And then push in, pull in. Perfect. Okay. And then the last thing that we are going to do is if you want to go ahead and pick your feet just a little bit up. Okay, so pull against my hands. Perfect. Okay, now push down. Okay, perfect. So overall, he's generally symmetric. No deformities noted. Muscle mass is even bilaterally, left and right, upper and lower extremities. Grip strengths were equal in hands, arms, legs, and feet. Full range of motion in all extremities. No deformities noted. Skin's intact. No discoloration or anything like that noted. No swelling of joints. And then no complaint of any of the joints, any joint pain or anything like that. Okay? Perfect. Alrighty, so that is all.